Africa is facing growing concern over a deadly Ebola outbreak that continues to spread across parts of Central and East Africa, raising fears of a wider regional health emergency.
Declaring the FIC, I immediately convened an emergency committee under the IHR, which met yesterday and agreed that the situation is a public health emergency of international concern, but is not a pandemic emergency. WHO assesses the risk of the epidemic as the high at the national and regional levels and low at the global level.
Health officials in the Democratic Republic of Congo and neighboring Uganda have reported increasing numbers of suspected and confirmed infections, with hundreds of monitored cases and a rising death toll placing enormous pressure on local healthcare systems. International health agencies warn that countries with heavy cross-border movement, including Rwanda, South Sudan, Kenya, Tanzania, and Burundi, remain at elevated risk due to trade routes, refugee movement, and regional travel connections. Medical response teams are intensifying efforts to contain the outbreak through rapid testing, contact tracing, patient isolation, and emergency treatment operations. Quarantine procedures and community awareness campaigns are also being expanded in affected areas. While the World Health Organization and African health authorities continue supplying laboratories, protective equipment, vaccines where available, and trained emergency personnel to frontline healthcare workers. Officials emphasize that Ebola is a severe viral disease spread through direct contact with infected bodily fluids and is not airborne. Symptoms often begin with fever, weakness, headaches, and muscle pain before progressing to vomiting, diarrhea, and in severe cases, internal bleeding. Early detection and immediate medical treatment remain critical to improving survival rates and slowing transmission. As concern grows over international spread, several countries have strengthened airport and border health monitoring systems. Enhanced screening measures, including temperature checks and health assessments, are being used to identify potentially infected travelers while minimizing unnecessary disruption to trade and humanitarian operations. In the United States, travelers from Ebola-affected areas may be routed through designated international airports equipped with specialized public health screening facilities. Health experts say transparent reporting, international cooperation, and rapid emergency response remain essential to preventing the outbreak from escalating into a larger global public health crisis. This is Signal 60 Global Pulse. Stay ahead of the pulse.